Today, I want to talk about the differences between the midwifery model of care and the medical model of care. Hi, I'm Anna. I'm a registered nurse, a childbirth educator, a lactation counselor, and a birth doula, supporting expats in the Eindhoven region of the Netherlands. As someone who has worked and given birth in systems that use both the midwifery model and the medical model of care, I think that it's important to understand both models and how they influence our birth experiences. So let's start with the midwifery model of care, which is what the majority of pregnant expats in the Netherlands will encounter first. So the midwifery model of care is based on the philosophy that birth is a normal, healthy process. Midwives are highly trained professionals, and they provide personalized care that is focused on holistic support, empowerment, and minimal interventions. Midwives address physical, emotional, and psychological aspects of the pregnant person. They involve the pregnant person and their partner in the decision-making process and make sure that they feel informed. They also closely monitor pregnancy and labor while avoiding unnecessary interventions unless a problem arises. In the Netherlands, this model is the standard for low-risk pregnancies. Midwives are the ones who guide care during pregnancy, and they attend births either at home, at the birth center, or at the hospital as an outpatient birth. And the midwife will transfer care to a gynecologist or an obstetrician if any complications arise. At that point, birth will take place in the hospital as an inpatient birth. So this brings us to the medical model of care, which treats pregnancy and birth as conditions that need to be managed. Care in that medical model often includes frequent interventions, such as extra testing, more ultrasounds, continuous fetal monitoring, and inductions. Standard protocols usually dominate rather than individualized care plans, and it's gynecologists or obstetricians that manage medicalized births in the hospital setting. While the medical model is really important in high-risk pregnancies and emergencies, applying it universally can lead to unnecessary interventions and undesired outcomes. So let's focus now on the Netherlands and why it stands out. The Netherlands has one of the highest rates of midwifery-led care in the world. Home births are widely accessible here, and around 13% of births do occur at home supported by midwives. The Netherlands uses this model of care because research continually shows that the midwifery model of care leads to better outcomes for both birthing people and babies. When there are lower intervention rates, it means that there are fewer cesarean births. And birthing people report having a more satisfying and empowering birth when they are supported by a midwife. For low-risk pregnancies, midwifery-attended births in a home birth or birth center setting are just as safe as in a hospital setting. I've worked and given birth in both the US and Vietnam, and I've seen firsthand how these models of care influence birth experiences. In the US, the medical model of care usually dominates, although it really depends on the region where you live. Midwifery-led care and home births are actually on the rise. In Vietnam, however, the medical model of care is predominantly used, especially in the more populated parts of the country, and choices can feel limited. The Netherlands trusts the midwifery model of care and its emphasis on informed choice, and this truly empowers birthing people. So what can we take away from this? Though the midwifery model of care can feel new and maybe a little uncomfortable to expats, especially those coming from countries where the medical model is the only option, it really reminds us that birth is a normal, healthy process. By focusing on personalized, low-intervention care, this model leads to better outcomes and it fosters a sense of trust in the birthing person's body and the birthing process. If you found this video helpful, please like or subscribe for more videos about pregnancy, birth, breastfeeding, and postpartum care. Do you have any questions? Drop them below in the comments. I'd love to hear from you. And if you feel ready to empower your pregnancy or birth experience and enter parenthood with confidence, please get in touch for a free consultation. Thanks so much for watching.